Hello, my name is Florian Lagler and I'm pediatrician and pharmacologist by training. I see patients with lysosomal storage diseases here in Salzburg at the Paracelsus Medical University, Salzburg. This includes a lot of MPS patients with mucopolysaccharidosis. In my clinical practice, I see patients with all kinds of different lysosomal storage diseases. This includes patients with mucopolysaccharidosis, Gaucher disease, Fabry disease, Pompe disease, and a number of other diseases. As a pediatric pharmacologist, I'm sometimes referred to when it comes to individual treatment trials with other inherited metabolic diseases or other rare diseases. MPS II is one form of mucopolysaccharidosis. There are 7 different forms of mucopolysaccharidosis. The mucopolysaccharidosis refer to the group of lysosomal storage diseases. All of these diseases are very rare and they are based on an enzymatic defect. This means an enzyme in the body of the patient is not fully active, and that leads to accumulation of metabolites. The accumulation of metabolites leads to swelling and dysfunction of the cells, of the organs, and then to a plenty of clinical symptoms. Mucopolysaccharidosis are a group of very complex diseases. They present with a plenty of clinical signs, and this really needs a sorrowful and very careful approach. What are the first symptoms in the life of an MPS patient? This can vary from patient to patient and from MPS form to MPS form. Early signs can be hernia, inguinal hernia, umbilical hernia, for example, or also hydrocephalus, for example. The early symptoms of mucopolysaccharidosis can be very diverse, including a lot of ENT problems with enlarged tonsils and adenoids, for example. And in an ideal case, an ENT physician would recognize a patient that has ENT problems plus, for example, problems in the skeleton or cognitive delay, developmental delay, as a rather complex patient that needs further follow-up. So the clinical symptoms of Hunter syndrome, and I have to say that Hunter syndrome is a chronically progressive disease, so it can start very early, and symptoms are increasing in severity. The difficulty in doing the early diagnosis is in recognizing the patterns, because the single symptoms like inguinal hernia, for example, hydrocephalus or spinal stiffness as such are rather unspecific, and therefore it needs a physician that recognizes that the combination of these symptoms can be indicative for a rare disease like mucopolysaccharidosis. Well, the diagnostic odyssey, or in other words, the time until the patients are referred to further workup in a specialized center, can vary substantially. It can be challenging for pediatricians and other physicians to recognize the patterns that indicate a rare disease like mucopolysaccharidosis. So sometimes it takes the parents 5 or 6 years until they are referred to a specialist who can do the diagnosis. On the other hand, I have adult patients that have been diagnosed in an age of 30 years, for example, because they present with a rather mild course of the disease, but that's a different story. When it comes to misdiagnose of MPS II, it's not so much that there is differential diagnosis, other diseases that MPSs are mixed up with. It's rather that a single symptom is followed as such, like for example spinal stiffness or hernias, hearing loss, enlarged tonsils, enlarged adenoids, so in other words ENT problems, recurrent infections, without seeing the connection between the plenty of these symptoms. And therefore oftentimes these unspecific signs of MPSs are taken as such and not considered one symptom of a complex disease like mucopolysaccharidosis. So the families face a diagnostic odyssey sometimes, from the family pediatrician to the orthopedic, to the neuropediatrician, to the ENT physician, and so on and so on. It's not a rare case that my patients see 8 or 9 physicians or 8 or 9 different disciplines before they are referred to the Center for Rare Diseases or the Metabolic Center for further workup. So this comes with a lot of burden for the families, including uncertainty. What is wrong with my child? Why can't they find the right diagnosis, and so on. And of course, parents have to repeat and repeat and repeat their history to different parts of the health system, which can be annoying on the one hand and frightening as well, because parents at some point often have the impression that their child cannot be helped. So in Austria we have around 45 patients with mucopolysaccharidosis, and I'm more or less in contact with most of them because they come to my center or via the patient organization MPS Austria. When I started seeing these patients, I recognized rather early that this needs an interdisciplinary team approach. You need a lot of specialists to see these patients. A metabolic pediatrician or pharmacologist is not sufficient. You need good partners, orthopedics, ENT physicians, and so on. So it's always good to have an interdisciplinary, interprofessional team that is really interested in these patients who are rather complex in the clinical management. So I would say this was a very early insight of mine to understand the importance of the interdisciplinary team to take care for these patients. As it is a very rare disease, a general pediatrician may not be aware of that. This is why a Hunter's patient needs follow-up at a specialized center. My patients have a yearly checkup in which the all organs that can be involved in Hunter's disease are checked for progression of the disease. So what does the interdisciplinary specialized management at a specialized center mean to the families of Hunter's disease patients? It means they have a vis-a-vis that is very aware of the problems, of the needs of these complicated patients. And they take care in a proactive way to early diagnose and counteract the disease complications. So many patients and their families are really disappointed by the health system because they face situations in which they again and again and again have to repeat the problems of a Hunter's patient, the problems of their children. They feel like they never find a physician that is really aware of their needs and the specific risks of their children. If a patient is followed in a specialized metabolic center with experience in managing MPS patients, this is different. As a matter of fact, these specialized centers also used to be in close cooperation with a patient organization, and that opens another door for the families, so there can be experience and know-how provided by the medical system, and in addition experience and know-how provided by other families and by patient organizations. A referral to the center always works best if you have a close contact to the referring centers. So I do a lot of awareness with my colleagues. I give them presentations on rare diseases, particularly mucopolysaccharidosis, and in many cases the patient is not referred to as a suspected MPS patient, but a patient that may have a rare disease. So the reason why my colleagues in ENT, for example, or orthopedics, or general practitioners, or pediatricians in the field refer the patients to the metabolic center or a center for rare diseases is the combination of different symptoms that they cannot align with one single diagnosis with a common disease. If you see a patient that has, for example, orthopedic problems, but in addition cognitive delay, developmental delay, or hearing loss, for example, think of an inherited disease and send the patient to the Center for Rare Diseases for further workup. The cases that are referred to the center very early oftentimes come from centers that just have experienced one patient before. In other words, the second diagnosis is always easier than the first diagnosis in a non-specialized environment. And then another group of early diagnosed patients, of course, are the siblings. If an index patient is a younger sibling which is also affected, then the parents are alert, the physicians are alert, and the patients are referred to the specialized center rather early. How does a child with mucopolysaccharidosis change the family life or the situation of a family? I think this is rather dramatic, and I have to say honestly, even being a physician very interested in MPS patients and the disease as such, there is not many diseases in pediatrics that change the life of the families so substantially than mucopolysaccharidosis. It's a very complex disease. These patients need a lot of surgical procedure. They always need an interdisciplinary team that takes care for them. And that comes with a lot of demand to their parents, to their family. And it's really good to know if there is a patient organization that kind of supports these families and helps mastering the situation. It's really an enormous challenge for these families. And I have the impression that after a diagnostic odyssey, it's always a big relief for the families to finally end up at a specialized center.